1/3 of all the results you get are placebo. Wouldn't you want to harness that shit?
I know. I wish I knew how to do it.
I mean,
useless. But and to do it at less than $5,000 a pop, like SOT placebo is.
People are suffering.
Yep.
People like our friends and our families and myself in the past, the 85% of people are going to get substantially better as long as they work with a Lyme literate physician, they use the correct antimicrobials, usually prescribed by the actual Lyme literate clinician, and then consistency. And I would talk about duration of therapy. It's long. Hey everybody, Dr. Tom here with you for this episode of the Lyme Insider, and I'm really excited tonight because we have my good friend Marty Ross. He's a medical doctor. He has treatlyme.net or treatinglyme.net. We'll have him clarify that in a second. He is the author of Hacking Lyme Disease, an action guide to wellness, and he is one of the greatest minds in the Lyme game these days, according to me, because when we sit down and have conversations, we've got the passion, we've got the art, but he's so dedicated to the science behind what we do to help people heal. It's a very unique blend, and he doesn't get on the leading edge of the latest, greatest concept until he goes and really boils it down, looks at the science behind it, and then figure out how it really affects the unique individual that's sitting in front of him and treats everybody totally uniquely. So I'm super excited. Marty, thanks for joining us tonight.
Great. Tom, thank you for having me. It's as I was saying as we were introducing ourselves earlier, I just love talking with like minds. So, and I appreciate all the work you've been doing to help educate providers and help people living with this illness as well too. So good to be here. Good to be here.
Yeah. Well, thank you. You know, I always have so much fun when we chat because we're always in the hallway, after a lecture at say iLads or A4M or whatever. And it's really, you do have this unique blend of super nerded out science, if you will. I mean that in a very loving way because I feel the same way about myself. But also, you're not letting what we don't know yet hold you back, but you're also not letting what we don't know or we think we kind of know mess up what you're doing. So I really think that I'd love to dive into that tonight and how we're going. But a little bit, one of the things I'm so interested in is kind of people's personal journey, before I dive into all the medical mumbo jumbo. It's what's your motive? How'd you get here? And what's your motivation for really specializing in integrative medicine and then being crazy enough to focus on chronic illnesses like Lyme disease and some of the other associated tick-borne illnesses?
Sure. So it's kind of an interesting journey. So it starts, briefly, it starts back during my residency and family medicine residency in Washington, D.C. I trained in an urban inner city program hosted by Georgetown at a separate hospital, but it was family medicine. And one of the lecturers that used to come talk to us for the didactic conferences we had, the psychosocial ones, was a guy named Jim Gordon. I don't know if many of you know Jim Gordon, Dr. Jim Gordon, but he's a psychiatrist that does a lot of mind-body education workshops, and even does now is working in war zones trying to help people recover. But anyhow, he was one of our and he came in, he was teaching all these crazy breathing exercises and diet nutrition using herbs, and he never talked in his own practice, he doesn't use any prescription medicines at all. So in my last year of residency, I had 2 months rotations, free rotation I could do with anyone. I wound up working with him directly in his office. And it was the most fascinating thing in the world. Everyone got nutrition, counseling, maybe herbal medicines, acupuncture. And he never used a drug. And he was getting people well. And so that was my exposure. And so what happened then is I kind of detoured. I wound up working in the United States Senate for 3 years, writing healthcare law during the.
My God!
I was the lead medical health policy advisor to the Republicans. I'm a knee-jerk liberal, but to the Republicans at that time, and Nancy Kassebaum, who was the head Republican, sitting opposite Ted Kennedy, who was the head Democrat. And so I was there to help out with healthcare reform and also program oversight, all the NIH, the CDC, all that stuff. And so I did it for 3 years. It was a great experience, had a great time. But in the end, I wanted to get back to practice again. And I was looking to kind of expand that policy background I had But yet I wanted to work back in my focus of helping underserved people again too. So I sought out a medical director job in community health centers. And it just so happened that the center out in Seattle, Community Health Centers in King County, was looking for a medical director that would help them set up an alternative medicine clinic within one of their 6 freestanding family medicine clinics. And because of my background and acceptance from working with Jim Gordon, they hired me.
Wow.
So we wound up working, we got a grant from the county, and we worked with Bastyr University as a co-grantee to set up the nation's first publicly funded integrative alternative medicine clinic. And, basically it was family docs working side by side with chiropractors, acupuncturists, naturopathic doctors, nutritionists, but still it was one of its first kind, right? And so in that setting, then I started working and I started thinking, I want to do all this stuff myself. And the problem is in that kind of a setting, because grants buy healthcare visits, not healthcare, physicians spending hours with a patient trying to figure out what to do does not work. So I had to leave that setting. And in 2000, I set up my own private practice, and and I did it. The first thing I added in was I took the Helms UCLA acupuncture course. And so I added in acupuncture, and my waiting room filled up with people with fibromyalgia. And then that led to people with chronic fatigue syndrome. And I got training working with Jacob Teitelbaum and his approach to treating chronic fatigue syndrome. And finally, in 2004, a patient of mine said, I think I have Lyme disease. And I looked at her and I said, I don't have Lyme disease out here.
There's none of that.
But I tested her. Anyhow. I did the worst test you could do as a first test. I did a PCR test. And I say it's the worst test because it'll miss it 70% of the time. It's not sensitive. But her test came back positive. And that was an eye-opening journey for me. And so that's how I started going down the road. I discovered that 30% of my patients that had diagnosed as chronic fatigue fibro in Seattle actually had chronic tick-borne illnesses. And so it was really just journey of, I got turned on with alternative medicine during residency, and then I had the opportunity to get more exposure, and I just decided that's the path I want to walk. That's what juices me. And I look at, I have an interest in working with underserved populations. Well, people with chronic tick-borne illnesses are the most underserved population. So it kind of fits that desire of mine to help others that way too.
Nice. Yeah. It's so funny. I love when, we get an opportunity to talk about all these things because I had no idea. Right.
Yeah.
And it's like, I know you're passionate, but I didn't know where that all comes from and stuff. So that's absolutely amazing. And it's like, yeah. I do think one of the things that really was interesting when you mentioned that is in my journey, I had this, acute Lyme. And I was sick. I got treated with Doxy for 10 days. I was sick as a dog for 5 of them. Then I got better. And all this stuff crept in over the, in retrospect, everything crept back in. And ultimately, after they figured out all the psychiatric diagnoses were baloney because the meds didn't work the way. So for anybody who hears it's really weird. You really definitely have bipolar, but you're not responding to the meds like everybody else does. I mean, that's one of the things that jumped out. But I ultimately got that fibromyalgia diagnosis, right? And from a symptom perspective, it was legit. I mean, that's what I had.
Right.
But it was like fibromyalgia on steroids. And it was like when someone finally took the time like you did to look deeper and find that it was Lyme, then I also found out, hey, I had, undiagnosed babesiosis, heavy metal toxicity, and all these other things that we really needed to unwind. And so one of the things that I love about your approach is, and when people go to your website, read your book, check out your support group, you dive into the medicines and the research, and then you dive into the herbs and the research. And so one of the things that, obviously now I understand more about your background in that, but could you explain to us a bit about your approach and how you combine the different modalities that you've been trained in, both kind of more maybe conventional, more natural, and because I mean, this stuff is pretty complicated.
So, again, kind of the foundation of my approach is training I received from Jacob Teitelbaum, Dr. Teitelbaum, in his book From Fatigue to Fantastic. And so in his approach, his focus was always start looking at sleep, support the adrenal glands, clear intestinal yeast overgrowth, do something to lower cytokine. Anyhow, all of that stuff short of killing the tick-borne infections. And at that time, he was not aware of mold toxicity. So the stuff short of removing toxins, mold toxins, and killing germs, that approach is very much a naturopathic approach and very much comes out of treating chronic fatigue syndrome and fibromyalgia. So if you really look at my Ross, Lyme, and tick-borne diseases support protocol, foundationally, you can see pieces that I got out of working with Jacob Tiedemann. I mean, I'll just start with that, okay? All right. And then I layered in, how do you kill these germs? And how do you remove mold toxins? So that's kind of a quick overview. Now, for your listeners, a lot of people probably know my stuff, but I have two websites. One is Treat Lyme by Marty Ross MD, which is at treatlyme.net. And then I have an online supplement store called Marty Ross MD Supplements at treatlyme.com. And soon those are going to be combined together. I'm actually working with a developer to move both sites together. So those of you that use my resources, you'll be going to be seeing they're coming together basically. In addition, I have an online Lyme disease support group, membership group. It's a free group, but for people living with the illness, it's called Lyme United. And you can link off of either one of my websites. And then most recently, last week, I started a new weekly newsletter called Tickcraft. And I call it Wizardry Tips and Tricks for Tick-Borne Illnesses and Mold Toxicity. And it literally is 10 different things that you can do weekly. And it's written using a style called Smart Brevity, the Axios newsletter, Smart Brevity. And so I just released that last week too. So anyhow, those are the things I'm up to.
We'll make sure we get all that in the show notes for everybody so they can just click and get right connected with you for sure.
Absolutely. But anyhow, but to your point though, when you look at these illnesses, I like working with the concept of outcomes-based medicine. All right. But true outcomes-based medicine has been abused by the medical board system and conventional doctors to say that they will say, if there isn't a high quality study, double-blind, randomized, controlled with 1,000 million people, then it's not valid. All right. But if you really read about what outcomes-based medicine is, it says, use the best available science to drive what you're doing with your patients. And if that happens to be a laboratory study, because that is the only thing that you have, then you use that as a foundation. You go in knowing that lab studies do not necessarily mean what's going to happen in a human, but you still use that as a foundation to try things with your patients. And then you see how they respond. If it doesn't work, then you go on and do something else. But the foundation is always science-based. So for me to try something in my practice, I've got to at least find some basic science evidence. And if there isn't such a thing, then I'm a little bit more skeptical to try it. So for instance, SOT right now, I know there's a lot of practitioners trying that stuff out, but the science to me is it's extremely thin to non-existent. And so I'm not recommending that right now to people. So anyhow, that's how I approach it.
Well, just a quick interjection. It's funny because we talk about this in our Lyme practitioner training program a lot, and even patients ask me, and I've seen it work in certain conditions, but in terms of Lyme and tick-borne illnesses, I feel the same way with SOT, and I refer people to your article on it. And we'll definitely link to the SOT blog post because it's so well referenced. And it doesn't mean it doesn't work. It just means we don't have the evidence to really make it a strong recommendation at this time, or at least not in my practice.
True. I mean, I personally, and I may piss off some people for this next comment, I was dismayed that iLads had a part of their conference devoted to SOT training. I expect iLads to usually have a little bit more of a foundation behind things that they recommend. So I was a bit dismayed. Now, does it mean that it's not working? I don't know. I mean, keep in mind, because I know in my Lyme disease support group, my Lyme United group, I hear from people they ask a question about my opinion, and I respond, and we'll hear from people saying, well, it did work for me. Well, keep in mind, if we look at anything in any drug in approved drug, if you look at those that had the double-blind randomized controlled studies, any item that's been approved by the FDA using a double-blind randomized controlled study, about 35 to 40% of any benefit is a placebo effect. Right?
Yep.
So let's just say that these people that are spending their $5,000 getting something called SOT that in theory is supposed to do something for them, maybe it has nothing to do with the SOT. It's just that they took something that they think is supposed to benefit them and they get a healing effect out of it. So it could be some people are getting better because something got injected in them, not because that thing is actually working. And I just don't see the science behind it at all. Anyhow, yeah.
Yeah, I think this is one of the things I really love, and I may or may not have, ducked out a part of that conference just because of that as well, because it's tough. It's like I think in this field, we need to hold ourselves to a higher level, a higher standard, because we're under the microscope. And this is so important that one, we uphold the science. We, after all, are much more, we're scientists, right? But that doesn't, like you said, with the outcomes-based medicine, if we actually remember where it comes from, very important to understand. It doesn't mean we have to wait for the randomized double-blind placebo-controlled trial to treat anybody, but we do have to critically evaluate it. And when our number one organization really becomes all about, what's the latest and greatest and let's just throw it out there.
Right.
I mean, it bothers me a little bit. I know people who use it, they swear it works. I know people use it for viral stuff and say it works really great. But again, I'm going to link to your, not to belabor the point, because we could do that for a year.
We could spend another 40 minutes on this one, but
yeah.
But I have, as you know, I have a very referenced article about my opinion, and I'll be glad to link with you on that. So, yeah.
Yeah. So, and some of the things too that come up for me. So we'll definitely, as a reminder, we'll link to that so you guys can see Marty's article. The other thing is, there's a lot of other stuff out there that people ask about, and things like IV ozone, IV vitamin C, even hyperbaric therapies. I mean, how are you seeing those things play out, and any of the other adjunctive things that you could potentially spend a ton of extra money that you may or may not need to spend?
Right. So what's interesting, one of the things that's been helpful in my discussing those alternatives, and I'll come to a few of them here in a minute, is MyLymeData, which is a research group of LymeDisease.org. And basically what MyLymeData is people living with Lyme, tick-borne illnesses, mold toxicity, that have allowed information to be collected about them, and periodically, using that initial information, MyLymeData will go back and query those people to investigate something. And so I think it's maybe 2 or 3 years ago now, MyLymeData did a project looking at what are the benefits and side effects of various alternative therapies. And they came up with this whole table, and you can walk through it, and you can find that. I reference it at treatlyme.net. I have a whole article about what works. It's called, I think the main title is What Works. And I basically am using the data from MyLymeData. And it basically says, I think ozone and the oxidative therapies, I think it's about 35% of people report some benefit from using them. All right. So the trouble is that fits within your placebo effect range. So, so I tell people it may work, it may not, but if you really look at it, it falls in the placebo effect range. Here's what MyLymeData says, okay? But then I go into the science and I say, now here's the interesting thing. If you look at research, so one of the godfathers of using ozone is somebody that believed in using it to promote health, not necessarily kill germs. I forget what his name is, but he did a research project once where he took test tubes full of bacteria, and he put ozone in, killed all the germs. He repeated it by putting a small amount of blood into the test tube, added ozone in, and there was no killing. Yeah, no killing at all. So the basic science that has been done says in the presence of blood, like in your blood, like if you're giving IV ozone or you're doing rectal ozone, whatever gets absorbed in the blood, probably it's all being neutralized. So why are we using this stuff to kill germs when in a test tube it says it doesn't work? And we don't have human studies. The best we have is a test tube study, okay? All right, now, do people feel better for getting ozone? Yeah, but there's a reason for that. The basic science says that when you do ozone or you do these oxidative therapies, you probably have better oxygen delivery to your mitochondria, so you get a boost in mitochondrial energy output, okay? Now, my concern is if you do this enough, yes, short term, your body can handle the oxidative stress. But if you repeat, like some people are just doing weekly ozones, what oxidative damage are you doing to the mitochondria, your cell membranes, etc.? So those are the kind of conversations I have with my patients, but it's based on, what does the science say? And then more broadly about all these alternative therapies, I just pull out the chart from MyLymeData and say, hey, this is what people that have used it say. And then I'll throw in some of my existing science that I have on it as well too.
Yeah, and I'll link to that one as well, because I just pulled it up to make sure, and it's like, it's a very interesting article, because like you're really hitting on some of the really big ones. And like one of the things is, actually the last time I think we hung out was at A4M. I was lecturing on hyperbarics and glutathione and all this. It's really interesting. A lot of people one of the things that drives me nuts too is like stem cells and ozone and whatever. It's like the therapies that really could work need to be used more frequently, but they're really expensive, so people half-ass them. And the therapies that are just expensive enough that you need to have them do it weekly or every other week so that you can make money out of your office are overutilized. And an example is like HBOT. Like the first couple, if you're doing it's better to do a series as a general statement, not for each individual. You got to work with a clinician who really knows what they're doing. But the first several treatments are very oxidative. There's a ton of oxidative stress, and then they become antioxidant only if you continually use them. And it's like, so it's really an interesting thing, because a lot of the providers are really trying to help, but I think we need to hold ourselves to that higher standard. So, I really appreciate the depth, and that's why I'm glad we're having this conversation, that depth of review. And it's like, and reality is like, hey, this is what the patients are saying. This isn't even like the science. This is just a summary of the experience of people who have chronic Lyme disease, and they're even saying it doesn't work.
Right.
So
I mean, 30-35% say they get some benefit, but again, is it really what you gave them that's doing it, or is all healing placebo effect? I mean, I have to raise that every time. When there's a report that 35 to 40% of people got better, you have to ask the question, is it all placebo? You have to ask it. You just have to ask that question, basically. So, yeah. Yeah,
well, and then the other thing, and I would love to hear what this brings up for you, that I talk about a lot, is if a third of all the results you get are placebo, wouldn't you want to harness that shit?
I know. I wish I knew how to do it. But and to do it at less than $5,000 a pop, like SOT placebo is, you know what I mean? So yeah. And I'm not sure if it's $5,000 they charge. When I've looked before, I know it's very expensive what people are charging.
It's very expensive, yeah. So, and that's in our practice. I offer people a lot of mind-body sort of practices, meditative hypnotic tracks, to help them get the sleep, to change their thinking. I give people exercises that, hey, like what you do during the day is like acting. You wake up in the morning and you decide whether or not you're going to follow that script or that script. Like, if you don't like the script you're following, why don't you change it and do a different one? I mean, most people know Tom Cruise as Ethan Hawke, right? Or Maverick. Right. And now he's like typecasted. I don't even know if he even knows who he is anymore. And that's okay. My point is, like, Keanu Reeves, anybody, I mean, whoever you like in the movies, Chris Helmsworth or whatever, they start to go down this path, and they start to read a script, and they get so into the script of what they're playing in the movie that they almost become that. And you can do that yourself. I mean, do you see, what kind of things are you recommending from sort of that mental, emotional, spiritual aspect for your people?
I'll call it more lifestyle to begin with, and then there is the mental, spiritual. But basically lifestyle. Arrange your life so you can get sleep. Number one. A lot of people don't, turn their computers off. They don't set aside the time. Now, granted, I know it may be harder than that in Lyme, but I'm just saying you got to do the basic stuff, right? If you can move. Yes, you may be tired, but if you can move. Movement is just great for the mind and the body and relaxing the soul. And then adding things in like meditation, I think can be helpful. Mindfulness as you approach life, and then diet. I mean, I really these days am becoming more a believer in a plant forward, not plant exclusive, but plant forward diet for support of the microbiome. The microbiome is basically the brain of every system in the body, right? And here we are dumping all these antibiotics in, and we need to. I mean, we do need to, but we need to do things to support the gut brain. And I call it the brain because it directs your heart, it directs your immune system, it directs your mind, it directs your mental health, right? So I like focusing on trying to get people to eat plants and having fiber as part of that. That's your prebiotic fibers. If you're eating a lot of colorful fruits and vegetables, that's your polyphenols that feed your good bacteria. Anyhow, I like to start with lifestyle, I guess, as a whole, of which, do you meditate? Do you do shamanism if that's your thing? Do you go to church if that's your thing? Having a spiritual aspect, it can be very helpful for people as well too.
Nice. So you bring up an interesting point too, is like sometimes we need antibiotics, sometimes we need herbs. I think, on your website and with your Lyme protocol, super in depth about like every thing you could potentially even consider.
Right.
What do you see most people need? I mean, I know everybody's an individual. I hope everyone listening gets that Marty and I are all about the unique individual that we're treating.
Yeah.
However, is there a general approach? Like people are like, hey, like how many people get better only with herbs? How many people have to have antibiotics? Do you feel like, we need all of this stuff, or where's really the most focus in your work?
Yeah. So I'll start with an observation, and this is from my days when I first, in 2000, when I went into working with integrative medicine. I used to think, how the hell am I supposed to tell people which thing to do, right? So they got a sore knee. Well, we could do acupuncture, we could get physical therapy for you, we could put you on these herbs. So I used to try to make the decision for them, and then I finally figured it out. You don't make decisions for anyone. You pitch ideas. And certain ideas are going to resonate with a person. And that's because I think energetically they're more in tune with that thing is going to work. So, for instance, when it comes down to the herbal versus prescription antibiotic decision, I will talk to a person. I will say, here's your options. We could go prescription. The risk of prescription probably is greater harm to the gut microbiome. The gut microbiome can help with all of these, your brain work right, your immune system work right, etc. Okay, all right. We can still protect your gut microbiome, but there's a risk, all right. Or we got these herbs that may work, and on the whole, when it comes to Borrelia, I think they can work as well as prescriptions. But when it comes to Bartonella and Babesia, I think prescriptives have maybe about a 5 to 10% better chance of helping you than herbal, but you've got greater chance of harm to the gut microbiome. Having said all that, where do you want to go? And you'll be amazed. There are some people that say, God, an herb never works for me. I want the drugs, right? And then there's other people that say, yeah, I don't get those antibiotics near me. I only want herbs. But you've got to engage your patient, because actually, I think we all have an inner knower. And when you throw out ideas, we connect with the inner knower. They call that intuition, whatever you want to call it. And I think there's something to that. All right. So then if people do ask me, well, what do you think? And I say, I've evolved over time. It used to be that everyone got prescription antibiotics in my practice. But I have become such a stalwart of trying to protect the intestines at all cost that these days I pretty much try to steer, if given an option, if they want to know where I would have them go, I usually will have them start with herbal antibiotic options, because I think you having less potential harm to the gut microbiome, you keep the immune system working better, then you get the brain working better, then etc. So that just tends to be where I've gone over time.
Nice. Yeah, I feel like a very similar approach I take. And one of the things I love is getting people back in touch with their gut reaction, with their inner knower. And everybody's like, oh, it's like people always want to know what the best brain detoxification supplement is. I'm like, sleep. Yeah. What's the best, lymphatic drainage technique, breathing and movement? What's the best way to get better? It's like, listen to your gut and your heart and follow that, so your stress hormones go down, and it's like, so it's so refreshing to hear sort of, that approach there.
It sounds like we work in similar ways, actually. So yeah.
I think it'd be really interesting to be a fly on the wall when you're working with people, because just from knowing you and chatting tonight, I'm like, it sounds like, because when you were saying the presentation, how you present that to people, I'm like, well, you could do this or you could do that, but I really want to protect this and what feels right. And I think that's one of the things, and I guess, for me, it's a challenging field we're in, right? Because I feel like part of what happens is people are not feeling well, and having been through this myself, it's almost like we escape from our bodies, like we separate from actually feeling. It's almost like in trauma. A lot of people who have experienced a physical or emotional trauma will essentially disconnect from their body as a compensatory protective mechanism. And I try to tell people, like, this is your physiology actually protecting you. And it also is now your responsibility and an access point to healing. So what are, and I mean, you've been doing this for quite a while and on the forefront. What are sort of the biggest changes, or challenges that you see for patients coming in, whether it's awareness and understanding of just the illness and the people around them, or just getting traction? I mean, I think that's the biggest part. What are you seeing holding people up, and how can they get past that?
Oh boy, that's a
loaded question, and
it's interesting because I think in my early days when I first started treating tick-borne illnesses, I was often the first person that people were seeing, right, with their illness, and so I don't practice clinical medicine. I stopped about 1.5 years ago, but before I stopped 1.5 years ago, primarily who I was seeing are people that were either referred by other practitioners who had already tried something, they weren't getting them well, or people, because of my books and my Lyme site, basically said, I'm not getting well after seeing 2 Lyme doctors or 3 Lyme doctors and all the other specialists. And so they select me. And so by the time often that people have gotten to see me, they're very educated already. They actually are fairly well educated. And so keep that in mind. Okay, I just want to say that. I think that the primary issues I think that people have are resources. It's an expensive illness. I mean, you know that, I know that, right? So how do they prioritize resources? How do we work within resources they have? How do we get them to think beyond the immediate resources? Credit cards can be used. I mean, how do we get them to focus on that? Okay. Number 2, having family support. I mean, you see it all the time. I mean, people, spouses often don't understand and tend to discount, and then we see breakage of relationships out of this illness as well. It's a very common thing. I mean, the stats on, I think, multiple sclerosis, for instance, has been very well studied. I think it's like 1/3 of people, or 50% of people, lose their partners through the course of the illness, right? So there's also that override about what to do with people's partners, and how do you give them resources to help their partners. And some of that is try to invite partners in if it's hospitable enough to do that. Some of that is trying to get partners into support groups as well too. But anyhow, those are the big impediments I see, is more financial and emotional support. But usually by the time people come to see me, they're already aware that I'm going to be talking to them about lifestyle. I'm going to be talking about sleep. I'm going to talk to them about lowering their cytokines. They've already looked at my stuff, so I already have that figured out, basically.
Yeah, I think it's so dead on. I mean, it's a draining thing. In fact, in our onboarding questionnaire, kind of like our application, so to speak, it's mostly just to help guide people. We ask about those 2 things in particular, and if and I work with a lot of kids, so I'm like, hey, how willing are they to do the changes, and how willing are you to do the changes so you could lead by example? But yeah, I mean, it's tough if you don't have support from those around you. I want to know about it so that we can help give you the resources to help them. Right. It's a challenge. And speaking of some of the challenges here, I mean, I know that you've kind of changed your focus in the last couple of years and really created this amazing resources to the next level for people. But what are you seeing like in the public and the medical community? Because you bring up partners and spouses. But like just in general, I mean, what challenges do you see like raising awareness and understanding of chronic tick-borne illnesses in a greater community? I mean, and do you have any ideas of what we could do to fix it?
Well, it's interesting. And you're probably aware of this too. I think if we look at those practitioners that are in the primary care fields, family medicine, even my local dermatologist, but family medicine, internal medicine, pediatrics, I think that there has been a great job over the years of groups like LymeDisease.org and Bay Area Lyme Foundation and all the various, the Cohen Foundation, all those groups have done a great job of spreading information. And I no longer think that the disapproving groups of people are the primary care docs. I think in general, they're open to it. They know there's stuff going on with their patients that the standard 21-day, 30 days of doxycycline doesn't cure. That doesn't mean they don't know what to do with it, but they at least acknowledge that something is going on. So I think that whatever has been done, with the advocacy groups, et cetera, I think they've done a great job spreading the word on that. The other thing I think that has been helpful, regrettably it's been helpful, is that this recognition that people have long COVID. When we started seeing people with COVID that got knocked down into this long COVID, I think that opened up greater acceptance of the idea that chronic tick-borne infections also have a similar state, if you will, right? And so I think that's been helpful. What I'm really discouraged by, though, is medical boards and specialists. I don't know what to do to get them to get it. I honestly don't. And I think the best we can do is, as an organization like ILADS, and I'd be glad to see this, instead of fighting constantly with infectious disease side of America, I think we just need to move beyond them and set a different conversation. And I have to say I'm proud of ILADS for doing that. I think they really have worked to reset the table to say, yeah, you guys keep talking over here, we're talking here, because this is what really is going on in the world. And I think that's been good. The various groups that have brought that kind of a conversation to the task force, the federal task force, I think they have changed the conversation that's happening out there. I mean, if you really look what happened here recently. We now have the FDA just approved new diagnostic criteria that IGeneX came up with and moved away from saying it only has to be a two-step test. You can actually do the standard that IGeneX uses on immunoblot, and that's all you need. I mean, that's a big change. That would not have happened years ago without this group, ILADS, and the advocacy groups resetting the table and saying, here's the table. Ignore those guys. They don't know what the hell they're talking about. And I think that's very important that we keep doing that kind of work.
I'm really glad that you bring that up, Marty, because one of the things that I think is really important here is building bridges, because I know a little bit about the inside of how that happened. And this was before all of the more recent conversations about overhauling the CDC and the FDA. This approval happened before that, and it was in the works for years, and there's more coming.
Yeah.
And I also know it from other organizations that are not just IGeneX. So, I mean, this is really, the FDA has now people in there who are looking at science. But one of the things that I wanted to share, based on what you were just saying, is one of the reasons they got into that IGeneX conversation was they're like, we've heard what everybody else has said, but we know some of the researchers working on this project personally, because we've done other projects with you, and we know that you're a pure scientist. So going back to pretty much our whole conversation, if we start with the science, we can create it. And the other, so personal relationships rather than divisiveness helped move this forward for the benefit of the patients in the field. Right. The other part that I think is really, interesting about the whole thing is that most of the time when we get a new drug or a new test, the FDA requires non-inferiority, and then they clear you or approve you depending upon what we're looking at. IGeneX actually proved superiority in every step of the way. So they had no chance, right? So we can take the higher ground is what I'm saying. And we have to, because people are suffering. Yep. People like our friends and our families and myself in the past So that's so important. So I just want everyone to really just take a moment and really digest what Dr. Marty's been saying is like, it's not that we don't use the science, if we don't have the best science, but we start with it and then we use our scientific reasoning on top of it, because ultimately we are now in a time where following science is actually making faster progress, safer progress, greater efficacy of outcomes than it used to. And I will say, I'll just throw it out there. I mean, there are some people that some people might call the Lyme devil or something similar because of where their previous stances were. But they are actually seeing the science change and changing what they said in the 70s, 80s, and 90s because the science is leading the way. And there's groups like the Global Lyme Alliance and others that are funding and pushing this. So just a little public service announcement: support LymeDisease.org, Lyme Disease Association, ILADS, Global Lyme Alliance.
I was going to say, two of the biggest there's three research groups that I have looked in with interest. Number one, Eva Soppi's research group out of New Haven, Connecticut. She did a lot of work that was foundational in biofilms and looking at that, and I think that was helpful. I think, though, that for a while, the torch got passed then to the Johns Hopkins labs and Ying Zhang's work, and a lot of his bench science on looking at persisters and even exploring like what herbs work on persisters, what prescriptions work on persisters, really expanding to say, we got to pull everything out here. Unfortunately, Dr. Zhang went back to China, so we've lost that lab, but we still had really good stuff coming out, even being published even up through last year, basically. And now I think who's doing probably some of the more fascinating work that is really also engaged in all these various task forces, Monica Amber's group. I mean, I think that she has been a game changer in terms of helping others understand what's going on with this illness. So to reiterate, we've been able to develop some foundation. It may not be the double-blind randomized controlled studies, but we've got some great bench science saying there's something going on here that is real. And fortunately, we've got some good groups that have been able to promote that and do that kind of work as well too.
Yeah. As you're kind of looking at like where things are going and how we've gotten sort of, I mean, it seems like every year we're getting more and more and more momentum. But I mean, are there any other, since like, I think it's important when we're trying to have this scientific and art conversation, are there other things out there that you think people might be jumping on the bandwagon a little too soon and we might want to look at a little more critically moving forward?
Well, the big areas that I see, we've already talked about SOT. I just think it's way premature at this point. And for a number, I mean, I'll even just briefly on that. I mean, part of the problem is testing. So RGCC is relying on a PCR test to identify these germs, right? But we already know it misses 70% of Lyme. And we don't even know what PCR sensitivity is for Babesia and Borrelia. No one's done it. No one has done PCR sensitivity for Borrelia and Babesia. It's probably horrendous because the stuff doesn't swim by the needle when you're drawing it, right? So what the hell is RGC sending people, basically, right? And the fact that they can say, well, you're better, look, it's all cleared. Bullshit. It's a negative test. It doesn't mean it's cleared. So anyhow, I'm just going to say that. Okay.
I feel the same way.
All right. Second thing is, I know there's a lot, the stem cell craze was there for a while. And if you look at MyLymeData, about 3 to 5% of people showed reported benefit from doing stem cells. That craze is still not gone, though. People are still interested in trying it under the impression that stem cells will regenerate anything. But we have to be clear about it. The type of stem cells that regenerate anything are either embryonic stem cells or what are called pluripotent stem cells. Those are the type of stem cells that can become anything, right? And here in the States, we don't have pluripotent stem cells and we can't do embryonic cells. So if you're getting it here in the States, be careful. God knows what you're getting. It is possible. I know there's some of the centers down in Mexico and India that are doing embryonic. There may be some benefits out of that. So that would be, I'm watching with interest to see what happens. And I know that some people are not using full stem cells. They're doing exosomes, which have growth factors and healing factors, etc. But still, I'm a little skeptical on that. All right. I know that another one that I'm kind of watching with interest, not sure where to go with it yet, is the idea of doing plasmapheresis, possibly for germ killing. I know that one of our colleagues is doing that, I believe, down in his Mexico clinic. I don't know. It sounds like a lot of hocus pocus. I don't see the science that supports that one as well, too. And then the other one that I find is interesting, it was quite the craze about 6 years ago, is Dr. Ty Vincent's LDI, low dose immunotherapy. And, I tried that initially, the idea being that you could use basically homeopathic doses of a germ to turn on the body to deal with that. And I know some of our colleagues still use it, but I just found I don't find that a lot of people are trying it anymore. And I think that over time, I think most patients learned it just doesn't do it. It may do it for a few people, but on the whole, it doesn't do it. So in terms of next big things, I don't know what it is right now. I think it's going to be probably combinations of herbs or prescriptions to attack the germ. I also think the next big thing is getting people on a valid antibiotic when they get their tick bite, or they might have gotten a tick bite. Get them on their 4 weeks, 4 weeks of doxycycline, and shut the thing down, right? Because the benefit of doing that, instead of, if we could stop this before it becomes a chronic infection, how wonderful that would be, right? So that's the other thing, is I think the advocacy that people are having to think Lyme, go into your doctor, think Lyme. I just hope that the doctors now are thinking 3 to 4 weeks of doxy, not 10 days, basically. So, yeah.
Yeah, and I'm fond of saying you can't have chronic Lyme if you've never had Lyme. And I love early diagnosis and treatment. So, and you think about it, I just remember years ago, my niece was on minocycline 100 milligrams twice a day for over 5 years for acne. And I'm not saying we shouldn't treat acne. I'm just saying, why can a dermatologist give 5 years of mino for vanity and some pain relief? We're not allowed to do it for a very slow growing organism that's more similar to tuberculosis or leprosy than it is to strep.
Right. Yeah.
I mean, basic bias, basic science.
Right. I agree. Yeah. What do you think? What are you saying that's around the corner?
That's a great question. I think that we need to start going back as the foundation in medicine, everything you've been talking about, the sleep, I think too many, the diet, the lifestyle, the exercise, the mindset, the simple things that you can do every day, the stress relief, understanding that the shit that you say to yourself all day, I'd challenge everybody listening. Yeah. For the next hour, write down everything you say about yourself to yourself. Yeah. You'll probably be done most of it in about 5 minutes or less. Yeah. And just go we talk about meditation, right? I love the word meditation because some people love it. Some people have a very negative taste to it. The definition I love is to become familiar with. So I challenge people to become familiar with the state that they want to live in. Yeah. So if what you're hearing in your head all day is not the state you want to live in, then just change it. And we have programs and courses, and I have tons of free information for people on how to do that, because I think that if a third of all medical outcomes are placebo, why not harness that? Because maybe the reason your SOT worked, like you said, is because someone took the time to talk to you and did an intervention. Maybe it's because you invested financially in it. And it's so I've talked to people, hey, we have a program. Oh, it's $97 a month. Oh, that's too much. I have chronic Lyme disease. I'm like, are you serious? Did you just tell God or the universe or source that $97 a month is too much for you to take responsibility for your own health and help you get better? Yeah. It's a challenge, right?
Yeah. Yeah.
So,
there's, it's interesting. I just thought a couple of, I agree with you all that. One of the things that's caught my attention lately is within the world of longevity medicine, there is some ideas that we can apply here to Lyme, and I've actually been discussing them within my Lyme United support group, and a lot of people are trying them, just trying it out and seeing. One is fasting mimicking diet, 5-day fasting mimicking diet. And the idea with the fasting mimicking diet is that on 5 days you average maybe about 700 calories a day, in a way that it's designed to give you an exact mix of amino acids, carbs, and fats, an exact portion. There's a commercial product called Prolon that's actually been researched. And what it does when you're fasting, you trigger autophagy, right? So how many of our patients basically, because of how sick they've been, are basically just swimming in garbage in their cells and they can't get better. Their immune system doesn't work, et cetera, right? So with a fasting mimicking diet, you can trigger autophagy. You can also, it is a useful resource as a senolytic to get rid of senescent cells, because the other thing we're realizing is your cells have a limited number of times they're going to divide. And when they stop dividing, they become senescent cells. Well, there's a natural limit, but also they will stop dividing under oxidative and infectious stress. So how many of our patients are just sitting there sick and inflamed because they're swimming in senescent cells? So the other thing I've been looking at is the idea of a fasting mimicking diet to help with that, but also adding in senolytic therapies like fisetin and like quercetin, periodically having those in a treatment. So those are some things I'm looking at, is the idea of what can we learn from longevity medicine that may impact the world of tick-borne illnesses. And then finally, I think it's really important to rehab the gut. You've got to rehab the gut. And one of the things I advocate when people stop treatment is to stay on a good mix of probiotics, prebiotics, and polyphenols to support the gut. And it may even involve doing, I wish we could do it, it's not there yet, but we could do fecal transplants on people from family members. If you look at Maggie Hassan's work, your family members probably have the same kind of microbiome as you do. So your healthy family members could give you the kind of microbiome that might get you well, not a universal donor out there, okay? So that, I think that could be useful. And then using postbiotics, kill poop.
Yeah, right.
You get all these growth factors, fatty acids, et cetera, that can rehab the gut too. So I'm very interested in looking at that and working with that more down the road as well too.
Yeah, I really love what you're talking about, because one of the things is everybody wants to kill it. What's the next kill thing? What's the next drainage thing? But I'm like, if our mitochondria and our cells are not optimally functioning, if we're not clean, like the holy grail to me of infectious intracellular infections is to get them out of the intracellular space, dead or alive, so that they can get dead and we can get rid of them. Right. So that autophagy process is critical. And so I think that that's really important. And like when you talk about the senolytics and stuff, it's like you're like, oh my God, like maybe I've killed it all, but I just have this buildup of shit in my body and I need to clean. I need to do some spring cleaning. And everybody's like, but I want my more glutathione IV. I want some more NAC and orlipoic acid. I'm like, but maybe you need to work on a different, pathway.
So I had a patient that was very, very sick, probably one of my sicker patients back when I was practicing in Seattle, back in the, probably around 2015, 2016 range, that we wound up doing, orals did not touch her, IV antibiotics did. And we ran that for about a year and got her probably 60% well, but she just couldn't get over the hurdle. And we just eventually decided to stop antibiotics. And on her own, she decided to do monthly to do a 1 week fast, a water fast. She came back to see me 6 months later and was completely well. Yeah, completely well. And I have to think with her, a lot of it was probably the senolytic as well as the autophagy effect of doing the fasting diet, basically. Yeah. Then that opened my eyes to look at that concept, basically.
Yeah, and I've even looked at people just go like full on keto, and they seem to have the keto flu way worse, like people with chronic Lyme, than everybody else. But if they push through it, or there's a way to do it scientifically and ease into it. But I mean, if you just push through it, man, I've seen people come out on the other end. And I mean, some of it's possibly breaking biofilms. I've even talked to Dave Asprey about, could we even test that? Could a ketogenic diet literally break bad biofilms and not harm good ones? Who knows? Right. But I just think it's that part of it is the autophagy and and maybe cleaning up their diet, but it's huge. And one of the things you mentioned too is like longevity. I tell people all the time, I learned so much about treating chronic illness by looking at what the biohackers and the longevity freaks are doing. And the reason is the stuff that helps you live really well long, is compounding interest on the really good health practices that help your cells function optimally each and every day now. So I'm really glad you brought that up.
Yeah, it's true. It's true. That is an area that's really caught my interest here lately. So yeah, I thought I'd share it. Yeah.
Yeah, the last dinner Marty and I had together, we actually shared that at a longevity conference that we were both speaking at. But it's important because it's like, you're like, why are the chronic illness docs going to the longevity conference? Like, one, we learn a lot in chronic illness that we can share with the longevity crew, and the longevity crew is helping us understand how to help you be healthier today, so that then you can get that compounding interest and live longer and have a happier life. So glad you brought that one up, Marty. It's like, it's a big deal. So, what are the, you're the, I mean, everybody tells me like I get a lot done and I'm doing all this and I see you everywhere, but I feel the same way about you. It's like, you've got treatlyme.net and .com, you've got the support group. And I mean, what are you working on? And the book, Hacking Lyme Disease, that action guide to wellness. So what are the projects that you're working on? I mean, obviously you're, even though you're not in clinical practice at the moment, I mean, you're still studying like crazy and educating people. So what's the world got to look forward to, expect from Marty Ross in the next couple years?
Well, it's interesting. I'm thinking I'm actually have developed a website that will be, it's going to be ready to go in about 2 months, but it's probably going to still take me about another 8 months to add all the content I need to it. And it is actually, it's a healthy aging website. It's called Boldality.com. It's a health and lifestyle website devoted to people embracing bold aging, basically. And some of it will have a biohacking component. Some of it is going to be very much lifestyle oriented. Some of it's going to be offering people bold readers like these Caddis readers that I have. Some of it's going to be having people sign up to find their life purpose in their midlife through a group called Modern Elder Academy. I mean, there's all these things, and so that's caught my interest. What I'm struggling with is, I'm pretty much a solo guy. I contract with somebody to fulfill my supplements for me, but and I have one customer rep that helps me with everything, but it's all the other stuff is me. And so I'm really interested in how AI has become another assistant for me that's making it so I can have 2 Martys. And I'm interested if I can get 3 Martys out of that eventually. But I think I may be on the verge for the first time of actually having to hire people to help me create and monitor content, because there's only one of me. And I'm sure you run into that issue as well, too. So, yeah.
So that's awesome. So Boldality, I love it.
Boldality.com. Yeah. I was originally going to call it Agetopia. And when I got to the branding people, they're like, no one wants to go to a website about age. And I'm like, yeah, but it's about Agetopia, the land of aging. No one wants that. And I said, okay. And they go, and so they had me talk about what I was trying to do. And they go, you talk about bold living a lot there. And I said, yeah. And they go, well, let's call it Boldality.
It's pretty. Yeah. I mean, holy cow. I love it. And it is, and it's interesting, like, this is the other part. I think that it's interesting that this comes up in our conversation. In order for us to help more people, we have to allow people to help us. And I think so we do need assistance. We do need AI. We need other people to check the AI did it right. Yeah. We might need a web developer or an assistant to help us, and we train them well. And so this is one of the things I see with our patients is like, they come to us and they ask for help, and then they don't do what we say. And then they wonder why they're not getting better. And it's like, I want to say that sometimes if you have questions, ask them. Right. If you're concerned or you're confused, ask the question. We're all here to help you. But at some point, we have to understand that we don't need to do more research. People like Dr. Marty Ross did the research for you. Now go back to what Marty said in the beginning, is getting into that intuition, what resonates with you, and then choose it. And then when you get afraid in an hour or a couple of days, rather than shit can the whole thing, call your practitioner back and say, hey, I got afraid. I'm ready to go, but I'm a little afraid. Can you coach me over that edge? Yeah. I mean, how do you it's just one of these things that like you're telling everybody, you're leading by example. And maybe and I know if you have medical stuff, you would reach out to people who can help you and listen to them, right, but also be critical about it. But even just in general life, this is a community of people who want to help you get better. How do you guide people through that, Marty? I mean, it's like, I thought we were kind of like wrapping up, and then I was like, oh my gosh, like, because there is this and again, I'm not judging anybody. I know that the way the nervous system works, right, is trying to keep you alive and protect you. So right, the fear and the paralyzation being, and all that stuff that comes up is real. And it's not like you have a poor constitution. That's your body and you're really being on your side. How do you coach people through that?
So it's interesting. So, I had some extra training in health coaching, basically. And so health coaching, ultimately is about trying to help a person understanding what they're going to do about their obstacles. We don't tell them what to do. I mean, it's people finding their own path through. So some of it is, I think, as we engage our patients, whether it's in the office or it's through our email systems, that we take a health coaching perspective, which is, I can't tell you how you're going to do it. Let's explore together what are your obstacles, and let's see if you can help come with some solution about how you're going to overcome that obstacle. So I think it's taking a health coach mindset. In my own practice, I know some practitioners, I don't know what you're doing. I know some practitioners have gotten to the point that they're charging for emails. I didn't do it. I left that open, but with an understanding that if I thought a person was abusing it, I would tell them. I made it very clear. I'm accessible to you. If you run into a problem, I want to hear from you. And that way I got ahead of it before I saw them at their next follow-up visit, right? And I'll be honest with you, I probably spent maybe a half hour a day doing my emails because I was very clear, only use this if. And people respected that. But in my discussions with them then through email, I actually would take more of a health coach perspective. What's your block? Why is that a block? What ideas do you have to overcome that? I think we have to take a health coach perspective on that. The other thing, I know that for some of the practitioners, it's just hard to find the time to do it. So you might want to look at having your people look at my Lyme United support group. It's a free membership support group, and within there, we have member forums where members are talking together and supporting each other. And I'm amazed at the conversations they have there. I have a office hours with Marty Ross MD segment, 2 hours a day, where I'll go through as many questions as I can. But that doesn't mean I'm getting through all of them. I'm just going through enough to educate people. It's an educational forum. I tell them I'm not your doctor. These are ideas to talk with your doctor about. And so I just want to throw that out for those that think their members might benefit from a physician-led Lyme disease support
conversation
option as well too.
Yeah, well, definitely. I'll make sure we get all the right links for everybody. I think that it's so incredible that you spend that amount of time supporting people. So I really want to make sure that everybody gets back and supports you. I mean, part of it is Marty's doing a lot of this stuff pro bono just because he loves and cares about humanity. So make sure you're out there, supporting the work he's doing. Grab his book. I think it's super important. And also, like, part of it is like, don't live in a poverty mindset. Don't live in a scarcity mindset. And if you may not actually have the cash right now, you can still join some of the free resources Marty has. You can go and leave a review for someone. Leaving a review online or like say on Amazon after you get to know somebody's work, that doesn't cost you anything, but that is a way to pay it forward. Sharing this information with other people, even just, I would appreciate you sharing the podcast with other people so that they can get connected to experts like Marty that are compassionate, that are out there doing all this work. So really, like, it's like helping other people isn't about always having money, but also I would challenge folks to not just say, I'm going to help once I feel better or once I get over the Lyme. Start acting as the person who already has gotten over Lyme and really help us build this community, because that's how, IGeneX changed the FDA and the CDC diagnostic criteria. And that's the other part. I'm glad that just came back to me. Once the FDA changed the criteria for lab testing, the CDC went ahead and did that. They basically reversed the Dearborn criteria from 1996 because of people like us and this community and the folks listening to this working together and being true to the science, and also saying the current understanding in science is limited. Let's move the science forward, and let's do it because we love people. So, and that. So one of the other things, Marty, like I really appreciate all your time, and this is an amazing conversation, and I know we could dive into a few of these things forever, but one of the things I always love, and this is like, we had a great conversation at the A4M Longevity Fest this year, or I guess it was last year at this point. But
December.
December. But outside your professional work, I mean, what do you love doing?
Oh my God. So,
I love the real people part of this. I mean, we're all big brain, big hearted people, but I love you,
So I relocated from Seattle to Austin, Texas. And the reason I had relocated here was for sunshine and hill country, because I ride a Harley motorcycle. I love getting out there, tooling around weekly on my Harley Davidson motorcycle. So that's one of the things I do. I also, I have a dog. I actually have, those are two of my dogs. Unfortunately, they both passed away this last year, but I already have replaced, not replaced, I'll never replace them, but I have a new dog. And it's because I just enjoy dog energy. I go out on 3 walks a day around my neighborhood with my dog. So I do that. And then I've developed, even though I've been here for about a little under 2 years now, I've developed a network of friends. I like to go out, and because I believe one of the strongest things for longevity is your social networks. And so I've got a good network of friends. And then finally, I love my mezcal. Now I know that's not the healthiest thing these days for what we're learning about. Even minor amounts are bad for you, but I think it's probably, I enjoy it because I know I have a social aspect with it as well too. But being in Austin, I've really learned to appreciate good mezcal. So yeah.
Excellent. I love it so much. I mean, I mean, the thing is, a little bit in moderation of most things is probably okay. Certain things, maybe not so much. A little mezcal sounds pretty all right to me.
Yeah.
So as we kind of close, Marty, like, I just want to see, give you kind of the last word. I mean, is there any advice you'd offer to folks who do have chronic Lyme that really, or other associated illnesses, to really help them navigate their journey? I mean, for me, it's about hope,
Yeah. Well, what I guess my final message is, I think that, my experience in my practice treating people with chronic Lyme disease, I find I was able to help about 85% of people get well to varying degrees, all right? Maybe not 100%, but well to varying degrees, so they can get back and engage their life and do the things they wanted to do. But the caveat on that, and the message I want to let people know, is it takes time. And we even know this from the Lyme disease, MyLymeData research, which basically the 3 things that got people well, the 3 key factors are working with a Lyme literate physician that can help steer you through the complexities. Number 2, being on antibiotics, and they didn't really ask whether it was they meant prescription, but I think they should have broke out herbal on that too, but they didn't, okay? And then 3, using for a year or more consistently. So I think that's the consistent part. There's a lot of people that get into this and they start and stop, and then they're not getting better, but it's because they didn't they didn't go with the mindset that it's going to take time, unfortunately. But I think if you go in with that mindset, you have an 85% chance of getting well and getting back into your life again. And stick with it consistently. Put the resources, spend the resources to do it, even if it means on your credit card, because in the end, you're going to have a good chance of being able to go out and make that money back again as well, too. So anyhow, those are my thoughts.
Can you just highlight that percentage one more time?
Yeah. Oh, my 85%?
Yes.
Yeah.
So 85% of people are going to get substantially better as long as they work with a Lyme literate physician, they use the correct antimicrobials, usually prescribed by the actual Lyme literate clinician, and then consistency. And I would talk about duration of therapy. It's long.
It's not, and you just got to buckle up to, and I don't mean to make it sound like it's buckle up, chin up. I don't mean it like that, but you do have to buckle up. You got to buckle up to get through this thing and to realize that you can get there, but it's just going to take time. And a lot of people have difficulty with that aspect of it. They want their quick fix. Antibiotic is going to have them well in a month. And if they don't get well, then suddenly it's a bad Lyme doctor. It's whatever. I mean, it's all those things, right? It's not. The MyLymeData stuff tells us it takes time working with a Lyme literate professional using an antibiotic, and I would expand it bigger. I think herbal antibiotics actually work too, but they didn't research that. So anyhow, yeah.
Awesome. Well, Dr. Marty Ross, I want to say thanks for joining us for this conversation. Like I said, we could talk forever, but I just wanted to say thank you for all the work you do, teaching. It's so interesting because it's like, whenever anybody needs a really great patient resource, I'm sending people to your book, to your website, the support group. That'll all be in the show notes for everybody. And also, like, I really have taken this stance of really wanting to train practitioners so that they can actually, the people, like you said, find a Lyme literate provider. I'm like, well, we have people go to conferences and read books, but now we need to train them to actually have that mentorship to get through, right?
I so appreciate what you're doing with your training group, because, not all people that are iLads members are equal. They're just not, right? And I know that's one of the frustrations a lot of my members of my Lyme United group have, is how to find a doctor. And I do say, go to iLads, find a member that gets you at least halfway in the door. But that doesn't mean that there are people that know how to work with the science, how to think broadly like you and I both do, right? So those are the kind of practitioners we need. And I so appreciate that you're doing that kind of training work as well too, Tom.
Yeah, well, I thank you so much. But I draw inspiration from like the work you're doing. And obviously we all have mentors and friends and colleagues that are all doing similar things, but it's that desire to really help the public get better, having been one of those patients, having treated family members who are ill. So from the bottom of my heart, so much gratitude. And we've had some people from the Lyme Disease Practitioner Certification and Mentorship Program kind of in our gallery here, sending us some chats here. Some of them I'll want to catch up with you for a Mezcal next time you run in each other. But, it's one of those bonuses. It's great to have people here asking some of the other questions of Marty and I. So I want to say thank you to all of them. But Marty, I know you're super busy. I appreciate all your time and look forward to the next time we can have a chat. Everybody check out all the links to Marty in the show notes. And thanks for joining us for this episode of the Lyme Insider.
Great. Thanks for everyone being here too. And thanks, Tom.